As time went on, though, I began to see how we slowly began to implement change. We started to bring about change as a group of hospitalists, and then really that kind of culminated in the last year, I would guess, that we really started to move forward with this vision, largely championed by some of our leaders within our groups and whatnot, as to the whole idea of this accountable care unit and how could we do our job better.
Myself, the biggest thing is not knowing when a physician's coming. I had a patient who came in with bilateral knee pain, and then by 1800 couldn't pick up a fork, and so there was something neurologically happening. And I phoned the physician, and the physician just said, "Well, he's a DNR." And it wasn't until the neurological surgeon actually phoned, because he had read the CT and said, "You need to contact the on-call neurosurgeon now." And so that patient's life was at risk, and my job is to act on behalf of the physician following the orders, and I couldn't trust that physician. And to me, I knew there has to be a better way. And so coming onto this unit, this accountable care unit, I trust the physicians. I know what they order. I can follow through with their orders, and they're there if something happens.
Into my 32nd year, and pretty well I've seen the full revolving since 1984 in this health district. Even being only 6 weeks in on this, I can finally give holistic care. I feel that our patients are not being used as guinea pigs, and that I have time, and maybe not on all days, but what I call pillow fluffing and hand holding, and actually being able to sit with the families, talk through a lot of their emotional and spiritual care that is needed for them in the transition of how their lives have changed.
What I am doing now is why I went into medicine. And you see it in this unit. You see it with the way that we're able to help people. You see it with the difference that we're making with patients and their families and how appreciative they are. You're seeing it in the way that our hospitalists are working together as the most incredible group of people that I've ever had the privilege of working with. You see it then with the way that the nursing staff, other staff that we work with, physiotherapists, pharmacists, occupational therapists, dietitians, all of those people, how they work together as a team and how they all come together and we're able to provide that, I think, incredible level of care to people. And it's actually a privilege to be a part of. And could I get that somewhere else? I honestly don't think I can. So I don't want to hop on a plane to go to work. I really, really don't. But having this kind of a workplace to come to, this environment, these people, doing what we're doing, it makes it really easy to hop on